Hi, I'm Dusty Rigsby, along with Bonnie Chi Lum.
You're watching Vital Signs from the Loma Linda University School of Medicine.
During this edition of Vital Signs, we'll take a look at how basic research enhances the training of physicians and scientists here at the School of Medicine.
Richard Schaefer will tell us how God changed the mind of a prominent physician who didn't want to join a one-horse medical school.
And we'll see another episode of Student Life here at Loma Linda.
That's all just ahead, right here on Vital Signs.
We're delighted to have with us Dr. Larry Sowers, Associate Dean for Basic Science and Translational Research, and Dr. Penny Dirksen-Hughes, Assistant Dean for Graduate Student Affairs. Welcome, both of you, Dr. Hughes, Dr. Sowers.
Thank you.
Thank you.
Dr. Sowers, can you tell us what is the importance of basic research in the education of medical students?
Well, the basic sciences have always been important in the education of physicians, but the role is undoubtedly increasing over the next generation. The amount of information that a physician needs to learn in medical school today has increased substantially, and we can't possibly teach all the facts that they need to know. Therefore, we have to provide them with a theoretical understanding so that they can face the challenges that they will experience in the future, and so that they can constantly learn after they have graduated from medical school, so that they can understand the challenges of new medicine, new diseases, and new problems that they'll face throughout their medical practice.
Do the students do much basic science research in their education on average?
Well, we have a substantial number of students who do. We're trying to create opportunities for all of the medical students to participate in research. I think at this point about half of our medical students do participate in laboratory research sometime during their educational experience.
Now, what types of research projects are there that students or maybe faculty are involved with here?
There's a wide variety. There's some that are very, very clinically based. There are some that are translational, which are kind of in between. There's some very basic science
And
ones.
maybe we should, help. What is translational when you say that?
Well, what translational means is that you try to take something that's been discovered in the laboratory and apply it to real-life patient care. And so sometimes people call that bench to bedside, but it also has to come back from the bedside to the bench, because sometimes you see things in patients that you didn't see earlier in the research, and those unexpected things mean you have to go back and try to figure out what was different or what was wrong. I think probably the hormone replacement therapy for women is an excellent example, where they had data, preclinical. They found some unexpected things in the clinic, and now they have to go back and try to figure it out. So that's what we mean by translational, is bench to bedside and back again. But you did ask about some of the projects. So we have a wide variety. There was one I wanted to tell you about, and that's one that we actually are doing with a running group present in the area called the Loma Linda Lopers. People have known for some time that runners or people who exercise regularly tend to do better on a number of different assessment tools in terms of longevity and quality of life, and only part of the reasons for that are known. So Dr. Hessinger and I, and Dr. Fyrick as well, kind of formed a little group of 3 to try to figure this out. We took blood samples from the runners at various points in their training program, starting at the beginning when they are basically couch potatoes, all the way along to when they could actually run the Los Angeles Marathon. And so we took blood samples at various points in their training schedule, we analyzed them for a bunch of stuff, and we figured out that when you exercise, if you're female but not if you're male, your levels of a substance called adiponectin go up. And adiponectin is a good thing. It's a beneficial substance. We're really not sure exactly what the mechanism is for that. We're really not sure why we don't see it in men, but we do see it at women at different levels of ability. So that's a novel finding, and that's been submitted for publication.
Sounds like some very interesting opportunities for our students to get involved in some important research. Thank you very much for coming and telling us about these opportunities for our students.
Thank you.
Thank you.
Every year, a few students choose to bridge the gap between basic science and clinical medicine. They pursue dual MD, PhD degrees. This curriculum requires a long-term commitment to research, in addition to all the requirements of a medical education. One such student is Jessica Slater. She spoke with us in her lab a few weeks ago.
I'm working on an MD, PhD dual degree here at Loma Linda University, and I chose that degree because I'm interested in both research and working with patients. And right now there's a bit of a gap in information between what's going on in the laboratory and what's needed on the clinic. And by having more people that are well acquainted with both research and medicine, we can help sort of bridge that gap, and so that's what I'm wanting to be a part of. My research is looking at the interplay between cancer and the immune system. And the immune system, for some reason, isn't attacking the cancer, isn't getting rid of the cancer in patients. And so what we're wanting to do is try to induce the immune system to really attack the cancer to help the current treatments that we have. There is no typical day, which is what makes it so fun. Some days you'll come into the lab and just be checking on your cells or your animals, and then other days you're here for 20 hours straight doing a series of experiments. And it provides a very interesting variety, which is a lot of fun. For kids who are interested in science, who like science, really the advice I would give is really nurture your curiosity, because that curiosity and that thirst for knowledge is really what drives research forward. It's really about finding what you love, what you like to find out more about, and just chasing after it. Personally, my long-term vision is to work in a pediatric oncology field, so working with kids with leukemias and lymphomas, and really using the techniques I've learned in the lab and using that research knowledge to try and bring that field forward so we can find better treatment for these kids that are suffering, and to really make some leaps and bounds where very little has been accomplished.
You'll meet nurse turned scientist, Dr. Danilyn Angeles, after this on-campus segment.
Working on my graduate degrees here has taught me a lot about thinking critically.
My research is on diabetes, and I originally decided to do research on diabetes because my dad's diabetic, so I have a passion to study this. And the type of research we're doing is in neurobiology, so the link between neurobiology and diabetes would be diabetic neuropathy, which is when your nerve impulses can't accomplish the things that they were meant to do. So what we're trying to figure out is how this happens.
We are one of the largest centers actually in stroke field in the country. So we are trying to find some new therapies for patients in the hospital. So anything we do here can be translated very quickly to clinical practice or clinical trials.
We're cutting edge. We're adding to the scientific literature, and we're advancing education.
Welcome back to Vital Signs, where we're focusing on research here at the Loma Linda University School of Medicine. Dr. Danilyn Angeles worked for many years in the neonatal intensive care unit at the Loma Linda University Medical Center. What she experienced there inspired her to pursue a career in research.
Well, I've always been interested in the human body. I want to know how the human body works. I want to know how the central nervous system works. I'm very curious as to how the heart works. So even though I'm working as a nurse, that's always been my passion. So I decided when I was given the opportunity here, since the school is right here down the street, I went for it. It's always been something I love to do. I've always been interested in reading and learning about the human body and the intricacies. I worked in the NICU for 20 years before I became a basic scientist researcher. And in those many months and years, I took care of many babies, premature babies. And I know and I noticed in our effort to save them, Many of these babies are born 16 weeks early, for example. They've only been in their mother's tummy for 6 months. And in an effort to save them, we have to do many procedures that are invasive, meaning there's side effects that my study, which is funded by the National Institutes of Health, would like to minimize. We want to find ways to decrease the negative effects of the procedures we do to keep these babies alive, decrease the pain, decrease the drop in oxygenation in their blood, decrease the damage to cells. Those are the important things we want to find and examine. Obviously, babies cannot talk, and one of our goals is to decrease pain. So we need to find ways to measure pain in these babies and see if what we're doing is decreasing the pain. We also have many students who are looking at the cord blood of babies when they're born and measuring those markers of low oxygenation in the cord blood of babies. If I were speaking to a student who's considering basic science as a career, I would tell them to choose a specific area that they're interested in, that they have passion about. Because if you are passionate about a topic, it will be fun. It's like eating chocolates, what I tell physiology. Physiology is fun to me. I have no problems reading on and on about topics concerning physiology. So choose an area of study that you're interested in and also have some practical knowledge about the area. Don't just depend on the books. Go out there and find applications to your area of study. For example, for me in NICU provided me with a relevant clinical application for the study of physiology.
Joining us in our studio is William Rowland, an MD PhD student at the School of Medicine. William, welcome to our studio.
Thank you. It's nice to be here.
Yeah, I'm very curious to find out, where did you go for your undergraduate studies?
I went to the University of California, Davis, and I studied neurobiology, physiology, and behavior.
Now, what led you to coming to here, since you started your studies up in UC Davis?
Well, I'm the son of a pastor, and in my 4 years of college, I didn't focus as much on the spiritual aspect of my life. So when I heard about Loma Linda and its whole person care and the spiritual aspect, it really interested me. I also came down and toured the research department and saw that there was a great neuroscience and stroke research lab, and that really got me interested as well.
And what made you decide to do both an MD and a PhD? Doesn't that take a long time?
Yeah, I guess it does. The MD degree I've always thought about doing since college. In my last year in college, I did some research, and again, seeing this neuroscience department, I figured I'd try and apply for the PhD.
And a PhD takes about how long?
Between 4 and 7 years.
And the MD is 4 years, so that's about 8 to 11 years.
Yes.
That's a long time after college.
Yes, indeed.
Takes a lot of commitment. Can you tell us about your research?
Well, the laboratory that I'm working in studies adult and neonatal forms of brain injury, either ischemic or hemorrhagic forms of stroke, as well as maternal hypoxia. I'm focused on the hemorrhagic form of stroke, and I'm currently doing research into an immunosuppressive drug that is in clinical trials and will be released for multiple sclerosis treatment pretty soon.
Now, given that you're pursuing both MD and PhD, how do you think that additional PhD education and experience will help you in patient care?
I think being able to think more critically about my diagnoses is going to be helpful. Having more background and experience in science, in physiological aspects of the human body, as well as being able to describe and explain to my patients and their families exactly what's going on in understandable terms.
Can you tell us about your experience with your professors and the directors of your lab?
Yeah, I mean, they're great people. They're quite respected around the world, actually. My primary investigator is an international, well-known neurosurgeon, neurologist. Some of the postdocs come from all over the world, Czech Republic, Yugoslavia, all these different places, and they're really great to work with. They're very supportive, and they love to teach, which is great for me.
Very good. Thank you very much for being with us.
Thank you.
Coming up on Vital Signs, we'll see another chapter in our continuing story of life as a medical student. But first, here's Richard Schaefer with a Loma Linda Heritage Snapshot.
Dr. Alfred Shryock was a graduate of the American Medical Missionary College in Battle Creek, Michigan. That was the first Seventh-day Adventist School of Medicine. He graduated in the year 1899. Dr. Shryock and his wife Stella established a family practice in Seattle, Washington, and built a new home on Queen Anne Hill, a residential suburb of Seattle. In 1908, they came to Southern California with their son Harold on vacation. They were especially interested in looking at the new sanitariums that had been established here, and they had a special interest in looking at Loma Linda because of its providential and spectacular beginnings. When they arrived in Loma Linda, the medical staff here announced to Alfred Shryock that they were about to start a school of medicine, and they asked him to join them to become a member of the medical staff and to teach in the School of Medicine. Dr. Shryock didn't think that was a good idea. As a matter of fact, on their way back to Seattle, he mentioned to his wife that he didn't care to be part of a one-horse medical school. But the physicians at Loma Linda didn't give up. They continued writing to Dr. Shryock, asking him to join the faculty, but they were unsuccessful. John Burden, the business manager of the Loma Linda Sanitarium, wrote to Dr. Shryock and offered him $20 a week. Dr. Shryock responded. He said he would be unable to meet his financial obligations on $20 a week. So Burden upped the ante. He said, "We will offer you $21 a week." Well, finally, the Shryock's decided maybe the Lord is in this. They knew all of the people here in Loma Linda from Battle Creek, Michigan. And so they decided to ask the Lord for a sign. And it was a very useful sign. If the Lord wanted them to come to Loma Linda, would he help them sell their brand new home on Queen Anne Hill? So one day on his way to work, Alfred Shryock stopped at a local realtor's office. He listed his home, and that home was sold by noon. It was in escrow by sundown. The Lord had made it perfectly clear what he wanted the Shryock's to do with their career. So Alfred and Stella Shryock arrived here in Loma Linda by Southern Pacific Railroad on New Year's Day, 1910. Eventually, Dr. Shryock and his son Harold became the dean of the School of Medicine. Behind me is Alfred Shryock Hall that was built in 1936 and named in 1959. Inside that building is the Alfred Shryock Museum of Embryology, one of the finest collections in the world.
Don't go anywhere. You won't want to miss the next chapter in the lives of our medical students.
To read up on stuff so that when they ask me questions, Dr. Hart likes to ask lots of questions, so I have to make sure that I know it. So I don't want to look like a deer in headlights.
What you got?
She measured at 35 for the fundal height.
Okay, so how much weight are you supposed to gain for an average size woman for pregnancy?
Average size, I believe it's 25 to 35.
Perfect, that's right. Let's go ahead and write her another script.
Okay. Third year is about going through different specialties of medicine, whether you like it or not, 7 days a week, 24 hours a day. Because even if you're not in clinic or at the hospital, then you should be studying. And if you're not studying, then you need to be sleeping. On the one hand, it's really great that we're doing it together, we understand each other, but it can sometimes cause us to be competitive with ourselves.
I know a lot of my friends who are married, but who their wife or husband is not in medical school. I mean, when they decide to stop studying, their wife is waiting for them, you know, like basically for them to spend time with each other. But for us, if I stop studying and, you know, and she's still studying, like I can't necessarily tell her to stop studying too.
In one way, it's been difficult to transition from second year to third year. Every new rotation, every new attending brings its different challenges. You don't always know what to expect.
Surgery is kind of notorious as being the hardest rotation that you do as a third year. You have very early mornings. Usually you're at the hospital by 5 in the morning, and sometimes you may not leave till 7. It kind of depends on when the team is done with their work. So it's not like a set schedule. It's kind of like when all the work is done. But I look forward to it. I like the operating room. I like the fact that you can definitively help someone and change someone's life. And not have to wonder, you know, did you do the right thing? Like you got the x-ray or you got the labs, you saw that this thing is broken and you went in and fixed it.
It's going to be really rough. I'm going to be working a little bit less than a slave.
I know that for me and Brittany, it's going to be probably very challenging because we'll both be on surgery and we'll be up very, very early and we'll be at different hospitals. So we may page each other throughout the day just to see how we're doing, but we won't see each other. And then once we come home, then you know you have to choose like, well, are we going to study or are we going to spend time with each other? And then we kind of crash and go to bed maybe at 9 something, and then wake up and do it again.
It's going to be a crazy day because we have a lecture starting at 7, then suture lab and all that stuff until 2 o'clock. I just want to go to sleep. Let's get ready to start this day.
Because I got 4 hours of sleep last night, I'm really not dragging, but if you had seen me last week when I was on call and I got 1 hour, well really it's more like 30 minutes of like sleep, like probably about like 3 o'clock in the morning, my speech was getting a little bit slurred. On average, I probably get about 3 hours of sleep when I'm on call, which is pretty good. If I ever get to like stitch something, then I'm usually pretty happy. That's all I think that you could really expect as a student. You're not gonna like cut any tissue or something like that. I don't think I'm confused about that too long. I know how to like run it through, but how do you normally start it?
So you can start it by actually anchoring it onto skin, just like you were closed there.
Okay.
So you can anchor it here.
Mm-hmm. I learned that I like the concept of the general surgeon where they know everything. They know a huge amount of medicine and they can operate also. So they're really like the super doctors, but I just don't like what they operate on, you know, like, and I didn't realize that until I came into it, you know, and so this is only 2 weeks in and I have 4 weeks left, but you know, this is just a process, I guess, of training us to be doctors. Like we're not getting trained right now to be a certain type of doctor, we're getting trained to be a doctor who can hopefully recognize a lot of different things. So I see the value in it. I did pretty well. I still needed some help with starting the suture and ending the suture, but I could run the suture across the wound pretty well. And so, you know, step by step, probably the next one I won't need help starting it and stopping anymore. At the county hospital in Riverside, it's like, they honestly couldn't tell that I wasn't a doctor. So, you know, even some of the nurses would be like, hey, you know, Dr. So-and-so, and I have to tell them, I'm sorry, not a doctor. And so they kind of treated you more like a doctor there and stuff like that. Whereas at Loma Linda, it's kind of like your like short white coat kind of just, you know, points out that you're at the bottom of the totem pole.
You have attendings, you have, you know, senior residents, and you have like junior residents, and you're just a medical student.
Thanks.
Okay.
Ask him to take a big breath.
Okay, take a deep breath for me.
And then have him open his eyes.
Okay, can you open your eyes?
No. Go ahead and check his lash reflex. And there's nothing.
Okay.
So he's asleep.
Just have to try to stay focused as much as I can so I can get it done, because I have to get it signed off in order to pass this rotation. So this is my last day, so I have to get one today.
There you go. That already looks better.
Yeah.
Okay, go to about the 7 mark, and then we'll put the laryngoscope in.
Okay.
This is my last 5 minutes in this hospital. Yes, of general surgery. I think a lot of this fatigue is not necessarily fatigue from this call, because it was pretty light. It was from just all the 6 weeks kind of combined together. I'm glad I'm done. I want to move on to something different. And I think that's what 30 is for. It's to teach you the skills that you need and to show you whether you want to do that for the rest of your life.
It's nice to be done with general surgery. Lots of long hours, making lots of mistakes. Well, I didn't kill any patients. And yeah, I'm happy to be done with it and go on to specialties and actually get out at a decent time. I can go home and cook and enjoy this nice weather that we've been having lately. So yeah, I'm happy, really happy.
You may hear us complaining about med school and life and all that stuff, but it's like, I mean, if anything was easy, everybody would do it. You know, the reason why becoming a doctor is held to this esteem is because not only do you need to be somewhat intelligent, I mean, intelligence is just like a baseline. You have to like have endurance. You have to have a lot of endurance to do things you don't feel like doing, to wake up at hours most people shouldn't be waking up at, to, you know, endure smells and sights that most people shouldn't have to, you know, deal with. And then to smile all the time while, you know, doing that. And that doesn't take intelligence, that takes something more. I think that takes compassion, that takes patience and a good character. I would definitely encourage anyone who, you know, wants to wake up every morning knowing that, you know, they probably will help someone that day, you know, probably will save someone's life that day. That's the kind of good reason to wake up in the morning.
We'd like to give a special thanks to those amazing students and to all our guests today.
Now for this show's question. After graduating from college, how many years does it typically take to get a combined MD, PhD degree?
Be sure to catch us next time when Vital Signs will feature two of Loma Linda's most famous alumni, Dr. James Slater, father of the proton beam treatment program at Loma Linda, and Dr. Leonard Bailey, pioneering heart transplant surgeon.
All that and more next time on Vital Signs.
Thanks for watching.